Hospitals are seeing increased cases of stomach infection, loose motions, dehydration, dizziness, and fever, all linked to the ongoing heat wave. They anticipate a huge surge in heat related admissions in the coming days as the weather department issues a red alert warning for Delhi and other parts. The Indian Meteorological Department has issued a red alert for heat waves in Delhi, Punjab, Haryana, and most parts of western Rajasthan last Sunday. Doctors have told us that heat related admissions have increased in the last week, with people showing symptoms of dehydration, gastroenteritis, and heat related fevers. Such admissions are expected to grow even further in the coming days as temperature spikes. According to doctors in Delhi NCR, excessive heat conditions mostly impact the elderly, infants, young kids, and working individuals involved in traveling or working out in the sun. The elderly and infants are affected due to inadequate heat control mechanisms of their body. Even if they don't venture out in the heat, they may still be affected. While we all know that dehydration is a major issue during this season, people must also remember to maintain the consumption of salt which we lose while sweating. Why? Because salt loss leads to a drop in blood pressure, creates dizziness, fainting, and even heart attack and stroke. Dehydration or salt loss leads to lethal injuries as well due to fainting, such as head injury due to a fall. Dehydration also leads to the thickness of blood because of water shortage in the body, and that thick blood can cause heart attack or brain strokes. Experts told us that the current weather conditions also leads to stomach infections as people try to drink more water or feel more thirsty, but at times they end up drinking unhygienic water. Now, how should you spot that you are suffering from heat related problems? You may feel like having a fever as your body's temperature might go up. The person may have an increased heart rate and may feel cramps, headache, and diarrhea. In extreme cases, loss of consciousness and seizures are also seen. Doctors have been noticing that a majority of elders are coming with illnesses. Most of them have pre-existing health conditions such as chronic respiratory, heart, and kidney diseases or diabetes. These people generally come with severe dehydration and low blood pressure. Such cases are dealt with caution as there is a danger of fluid overload as well. In this weather, old age people are advised to be extra careful against exposure to high temperatures. Also, one should stay away from consuming aerated drinks in the name of hydration because aerated drinks have a lot of sugar which makes them work exactly the opposite of what people expect them to do. Sugar in these drinks leads to dehydration. Yes, sugar draws more fluids from the body into your intestines and gut. The best way to hydrate yourself includes drinking water with a pinch of salt and sugar. You can drink coconut water. You can hydrate yourself by making homemade salt-based lassi or buttermilk. Lime water, which is called shikanji, is also a good way to drink water. Apart from hydration, you should avoid outside food and water. You should protect yourself from sun with goggles, hats, or umbrellas. Wear lightweight, loose cotton clothes and avoid peak sun hours between 12 noon to 3 p.m.
In recent days, I have found many of the patients come with the history of loose motions, nausea, vomiting, crampy abdominal pain, decreased urine output with high-grade fever. Some of these patients have blood in their stools. They are diagnosed as a case of severe gastroenteritis with dysentery, and they have the common history of taking food from outside such as marries, street foods in the restaurants. So in the summer there is a high chances of gastrointestinal infection. I would like to advise to avoid such type of infection and heat stroke. We should try to stay in the home during peak sunny days, peak sunny hours. Use homemade food and liquids such as shikanji, buttermilk, and lassi. Avoid outside food, carbonated drinks, high sugar drinks such as cold drinks, tea and coffee. Use goggles, umbrella and sunscreens when we are going outside, especially in the afternoon. Our advise children to stay in the home during afternoon or peak sunny hours, and take your water bottle with themselves to avoid dehydration during playing.
As you all know, in the last couple of weeks, we are seeing ambient temperatures more than 45 to 47 degrees Celsius. With this kind of temperature, the number of patients coming to OPD and emergency with symptoms of heat-related illnesses have increased suddenly. This always happens every year. In the month of May, we receive many patients. Every year we tell people to be careful about when they are moving out in sun, and they have to restrict their outdoor activities like playing basketball, football, young children especially. Because of this, one can suffer from heat related illnesses which can present in multiple ways. Somebody can have simple exhaustion, heat exhaustion, flushing, feeling dehydrated, and somebody can land up in hospital in emergency with neurological symptoms as in altered behavior. This all is preventable. One has to restrict activities during the peak hours of the day when the sun is out fully. From 9 a.m. to 3 p.m. one should restrict outdoor activities. If you are in the extremes of ages, for example, if you are an elderly person or a young children less than 12 years of age, one needs to restrict their activities during this hour. That is very important message. One has to wear loose fitting clothes. If you are feeling exhausted while in sun, shift yourself or remove yourself to a shaded area. Have plenty of water. This is definitely going to help. Remember, prevention is always better than suffering from any illness and landing up in hospital emergency.